everyone, my name is Demitria Sawelson. I'm a current third-year medical student from the American University of the Caribbean, rotating here at Ascension, Providence. I worked with Dr. Shoji as well as Dr. Moore on this case report. So without further ado, here is our case of necrotizing neurosarcoidosis. So as an introduction to sarcoidosis, it is an idiopathic inflammatory condition characterized by granulomatous inflammation. It most frequently involves the lungs, but in about 5% of patients, the central nervous system can actually be affected. And of this 5%, an even more rare subset exists of necrotizing sarcoidosis. And it is under this category of necrotizing neurosarcoid, which our case report will focus on today. So for our case, we had a 39-year-old woman with a past medical history of obesity, poorly controlled hypertension, chronic headaches, right-sided vision loss, as well as paresthesias, present to the emergency department with the chief complaints of dizziness, an unsteady gait, and frequent falls at home. So on initial imaging for our patient, we ordered a head CT as well as a CT angiogram, which were unremarkable. So we then ordered an MRI of the head, and it was on this imaging that revealed several extraaxial enhancing lesions within the brain, fourth ventricle, and numerous cranial nerves, including the right optic nerve, as well as the internal auditory canals bilaterally. And if you look on the image on your screen, you can see I'm highlighting the area of enhancement compressing the right optic nerve. We then ordered the MRI of the spine, which also revealed diffuse areas of nodular enhancement throughout the cervical, thoracic, and lumbar spines. So the next steps for confirming a diagnosis in our patient were to culture and biopsy the brain tissue itself. So cultures of meningeal tissue actually didn't yield any presence of acid-fast bacilli, consequently ruling out any evidence of CNS tuberculosis, which can also present with enhancing lesions on MRI. The biopsy revealed granulomatous inflammation with focal necrosis, so that is where we were able to confirm our suspicions of necrotizing neurosarcoidosis. In terms of the treatment for the patient, she will be receiving a multifactorial immunosuppressive therapy, which typically include methotrexate, cyclosporin, or cyclophosphamide. So in conclusion, this is a very rare example of necrotizing neurosarcoidosis, and in addition to this very rare diagnosis, this patient presented without the typical systemic manifestations that are characteristic of sarcoid. So again, it just highlights the importance that variants of sarcoid can present without these typical systemic symptoms. And again, emphasizes the importance of keeping a broad differential. So that's all I have, and I wanted to thank you for your time and for the opportunity to present today.